from Elegance Clinic Surat. This is in our YouTube channel Cosmetic Procedures video. Today we'll learn why some people get poor result in gynecomastia. As you all know, gynecomastia is the condition in which female-like breast develops on male chest. So when this female-like chest develops, so many boys, they are ashamed to change clothes in front of their friends. They avoid to go to gym or swimming pool or water parks with their families, and they feel depressed and they are not confident about themselves. This is the only indication, which is the major indication for gynecomastia surgery. And so many boys undergo gynecomastia surgery nowadays and they get very good result. There are causes for poor result in gynecomastia. Gynecomastia itself contains two things: fat, and centrally there is a gland which usually makes milk in females. But in true gynecomastia, gland must be there as well as surrounding fat is there. That fat is resistant to exercise, so exercise will not dissolve that fat. So only option is to remove that fat is liposuction, and the gland cannot be removed by liposuction, so has to be excised. So now, as you understand, gynecomastia surgery should include both liposuction and gland excision, open excision, so that if both things or both steps are not done correctly, you will not get a good result of gynecomastia. There are so many surgeons nowadays, they are also doing gynecomastia. Usually what they do is they put an incision over chest region and they excise the gland. As they excise the gland and the liposuction is not done, there is a crater deformity. So what is crater is, there is a depression on chest where the gland is removed and the surrounding fat is prominence. So when the patient stands up, there is depression on his chest. So this is a type of poor result what usually people who don't use liposuction can get. The other thing is the scar. The placement of scar done by plastic surgeon is at the junction of your areola and normal chest skin, means the junction of the black skin and your white skin, so that the scar will be very minimally visible or virtually not visible. While other people who do gynecomastia, they put scars on your chest skin, and the chest skin scar will be seen later on. The suturing technique of plastic surgeon is always better than any other surgeon, so that the scar formation will be very much less. But other people, they use bigger sutures, larger sutures, and they don't give support in the inner structures, so that the scar will be visible. So if the scar is visible, then this is a poor result, as we find it out. The other thing is, we talked about gland excision only, but there are some people, they do only liposuction and they use the various techniques of liposuctions, including laser or sonography, or they use some type of cannulas to break out that gland. But gland is really very tough structure and it does not break out with any liposuction technique. So initially you will find out that the result is good, but once the patient stands up, that bulging gland will always be seen. So only liposuction is not the answer for true gynecomastia. Yeah, it can be answer to pseudo-gynecomastia. Now what is pseudo-gynecomastia? It is just the collection of fat without any gland, but it looks like a female breast. So pseudo-gynecomastia can be corrected with liposuction only, but true gynecomastia has a gland also, and gland has to be excised, and that has to be excised in very nice fashion. So combining both, liposuction as well as the gland excision will give you very good result. The liposuction will give two advantages. It removes out your resistant fat so that the female like shape will go away. The other thing is it will allow your skin to constrict again to your given shape so that your chest skin will be constricted and it will be to the needed size of your chest. Liposuction even can give you the shape of the male chest, like it can give you shape of pectorals which can be easily seen. With liposuction, plastic surgeon removes gynecomastia, but they also take away the fat from the chest side roll. So once the fat from this area is also removed, then the result will be very good. So if only gynecomastia fat is removed and the side rolls are not corrected, the result will not be good. So this is also the one of the cause if you have combined liposuction as well as gland removal, but the chest rolls, if they are not corrected with this surgery, the result will not be a good result. The other causes for gynecomastia poor results are if the patient has grade 5 or grade 6 gynecomastia, or the patient is having heavy weight loss, or patient who are previously very fat and they have reduced their weight now and they are coming for gynecomastia surgery. Their skin is straight than normal size and it has lost its elasticity and the collagen content from inside. So once we do gynecomastia surgery, usually in all boys the skin will contract to its normal size and which is needed. But if the skin elasticity is not good, or the patient is aged, or patient was very fat, whatever the cause, if the skin contraction is not good, then the result of gynecomastia will not be natural even if you combine gland excision and liposuction. So in this type of case also you can get poor result of gynecomastia. To correct this type of result, you have to do skin excision. Now, skin excision can be planned two ways: on the same day of the operation of gynecomastia with liposuction and gland excision, or you may wait for 3 to 6 months for the skin to contract and then the extra skin can be excised in a nice way. So if the patient is very fat or very huge size of gynecomastia, secondary correction may be required for very good result. So what I think is there are mainly four reasons. Only liposuction is done and no gland excision. The second is only gland excised and no liposuction. Third is only gynecomastia surgery combining both but no chest rolls are corrected. And the fourth is very lax skin people or the patient who has lost his elasticity in the skin. There are other causes of poor result in gynecomastia is a scar formation. If the nipple and areola which are elevated are not sutured well, there are scar formation, there are discoloration, sometimes there is necrosis of the skin or nipple areola in area of the operation, and this will lead you to the poor result. Smokers are prone to get necrosis of skin in areola, nipple or the other regions. So patient has to avoid smoking 7 days before and 7 days after the surgery. Ideally, smoking has to be stopped. So we discussed this type of surgeries and the complications and the results. So if you want to get a good result from gynecomastia and you want to get rid of your gynecomastia and remove out your shirt publicly and confidently, you have to find out a very good gynecomastia surgeon in your territory. We do gynecomastia surgery routinely in our clinic. We do so many gynecomastias and we have relieved depression of so many boys from the gynecomastia. In case of any query regarding gynecomastia, you can contact our clinic on these given numbers. You can even WhatsApp your photographs and we'll call you on these numbers. You can personally come to our clinic, that is in Adajang, Surat. We don't have any other branches. And you can also visit our website, that is www.gynecomastiaindia.in and www.eleganceplasticsurgery.in. Thanks for watching the video.